So I'm core faculty with the Master's of Counseling Psychology program in the clinical program, and I love this teaching. I love being able to use experience to learn in the classroom, and love the interaction with the students and the freedom and the capacity to teach content in a way that lands in the body, maybe through creative expression and through talking. So bringing sort of a whole person approach to the classroom in education, where I can engage the mind, my heart, and my expression, and invite curiosity for learning while we incorporate content and a practical way of applying that kind of learning in our systems and within the world. So in a clinical capacity, I'm training counselors to become counselors. And so how can we stay embodied in, I would say, attunement and therapeutic presence, my own presence? How can I learn to be present with another being and also be able to engage with theories, for example, and apply them in the world in a practical way in relationship? So clinical psychology, I would say, it can be interpreted in different ways, I think. I'll just maybe speak to how it might be understood in the world, and also how this is a unique approach to it in my understanding. So with clinical psychology, we have the capacity to learn language, to diagnose, and some might say pathologize, right? So I think that's sort of mainstream, the medical model of diagnosis, which is important to have a common language. So we are trained to have a common language to look at health through a lens that encompasses a full spectrum of what might be considered dis-ease. So that would be maybe a lack of ease in the system, as I prefer to teach it. Or, with a label, we can use a common language to diagnose and have a deeper understanding of the human condition and how that plays out in different ways, individually and in the relationship, I'd say.
Yeah, so really whole person, whole systems orientated, and bringing all of that in.
Absolutely.
The clinical as well is this ability to diagnose, and yet going and not getting stuck in that, going beyond that.
Right, and the clinical bringing in the assessment, the diagnosis, and the paperwork, which many students might not like, to keep notes. We are required, it's ethical guidelines to keep notes, and for me, that's part of the grounding as a clinician and as a teacher, right? The whole person perspective of bringing that sort of writing and cognitive in to kind of land it, yet not get too stuck on it. So that's where the transpersonal comes in, as far as how do we flow with this clinical application, which might feel or seem limiting, yet it can be expansive depending on our perspective of it. I'd say so. I think it allows us the empowerment to be recognized as clinicians in the field, yet bring a certain element of the transpersonal to the field, which to me is a softening of those labels and diagnoses, maybe. The whole person approach, which, integrates the mind, body, and the spirit. And I don't know that other programs are really trained in that way. So I believe in our program in particular, there's a cohort model where we learn with the group, with the cohort, through the experience, and we get the content. So the feedback that I've heard from students who have graduated from our program, and having gone to a transpersonal program myself, the feedback is we learn how to sort of sit in our own bodies and sit with another person in ways that maybe other clinical trainings are not providing in the same way we are in terms of this experience. So there's a balance between the theory and the cognition and the application of it, and how can I feel comfortable in my presence with myself and with another, or with a group for that matter. So I think that this type of program, our program at Sofia University, really grounds the knowledge and the theory in an embodied way that allows a more fluid engagement and evolution of a professional therapist in the world. It's really foundational, I think, to relationship in general and to the field of clinical practice. Yeah, so sometimes it seems like these complex cases are just beyond. First of all, how could we imagine something like this might have happened in humanity sometimes? And just the tolerance level of pain, deep discomfort and pain. And so I'd say in our program, a lot, in my teaching in particular, in these foundational courses, there's a lot around attunement, attuning to myself and attuning to others, and also building an emotional tolerance for these complex cases, these complex situations that might feel unbearable, yet we can build the skills and the capacity for resilience and flexibility, and finding ways we can sit with ourselves in the face of intense stress, trauma, and complexities. And so how can we find the core within us to tolerate and then build? There are different frameworks that we teach this in, but how do we build this window of tolerance, or how do we build this capacity? Not to build a barrier, yet a fluid relational container. So I'd say it's about holding containment while also connecting. And that's a foundational skill, I think, to be with the intense pain and complexities of what we're seeing in the world today, in particular, as a group, collective, as a species, and individually. I'd say similar to what you just described in terms of this practice and the practical embodiment. I think we're even moving beyond the embodiment. So in typical educational or academic systems, we're in our thinking brains. And so we can talk about integrating the thinking and the feeling and the embodiment. And I think at Sofia University in particular, this transpersonal piece takes us beyond. So the transpersonal being beyond that physical form of what might be obvious or explicit, and really looking at the implicit and the unconscious, and that emergent trend, how to really be present with curiosity as to what is emerging here, what's being evoked, and how can we learn from the inside out and respond to what's happening in the world in a resonant way. So I think in terms of attunement to oneself, each other, we can talk about that in terms of our classroom, each other, in clinical practice, and then also how can we be in the world now to understand and respond to what the world needs. And I think Sofia University is really doing that in terms of paying attention to what's happening in the trends in the world, and how do we then respond in a way that also aligns to this sometimes traditional and sometimes not so traditional training and practice for clinicians. I'm thinking about the both and, even as you say, clinicians, successful clinicians. What does that mean? What will that look like? What does it look like now? What are some preconceived ideas about that, and where are we headed? And in the world of AI in particular. And there might be a lot of fear out there about AI. There might be excitement about AI. And personally, I feel that both can be valid. So that both and of, what feels, and tying it into clinical practice, what's out of my control and what's in my control. And even that word control, where am I trying to control? Or, the power over, power under. And so how do we relate to AI? So a lot of the core foundational work in clinical practice is about relationship. And so I would say AI is another entity, if you will, to which we can relate and get curious about, how am I relating to this? Am I relating in fear, out of fear? Am I running away from it? Or can I engage with it in a way that is supportive, ethical, and maintain my integrity as a human being? So I think what comes up for me is how to maintain the humanity while also engaging with AI in ways that could potentially be supportive to education, healthcare. It could be expansive, and how to discern when it's expansive and when it might be harmful. And again, that goes back to my own attunement with myself and tracking myself in this integrity and truth of who I am and how I am in the world as a person, as a clinician, and as an instructor.
Yeah.